Hi, friends. Thank you for spending the time getting to know more about the University of Washington Dermatology Residency program. This is an event that we used to hold live as a open house or meet and greet, and then we realized that that really excluded some people from participating, so decided to record it instead. But hope that you'll be able to find out a lot more about our program by joining us for this brief video. My name is Marcus Bose. I am the Residency Program Director.
And I'm Lisa Meyer. I'm the Associate Program Director.
I'm Mary Malam. I'm one of the co-chiefs.
I'm Steph Tim, and I'm the program administrator.
And we hope to give you a brief but comprehensive overview of what the training program and life is like in the dermatology residency here at UW. So without further ado, let's get started. So I think the most important thing that we want to communicate is just what our goals are for our program. So our vision is to cultivate diverse, compassionate, professional, and inquisitive future leaders and expert dermatologists. And really what we hope that you achieve here at UW is both a great medical education where you feel confident managing all sorts of different skin conditions in different patient populations, but also that you feel like you are supported to pursue your passions and really find your niche and path within dermatology. Next slide, please.
So we want to share with you some of our incredible strengths of our program. Our program really offers a wide breadth of clinical and non-clinical experiences. We have a strong didactic curriculum with really rich clinical experiences as well. And this includes multiple specialty clinics such as the adult and pediatric derm rheumatology clinic, hair disorders, bullous disorders, contact dermatitis, and so much more. So you're going to get a really great education that's going to be pretty broad. And what's, I think, even better is that we have a robust team of faculty that really love to teach. This is just one of, I think, the wonderful things about our program is that faculty are very committed to teaching and they love to do it, and they're very committed to resident education. We also understand that everybody's career path is a little different in terms of what you want to focus on and how you want to practice. And one strength that we have here is that we really want to support you in the exploration of your career and help you be successful in achieving your career goals. But I think our greatest strength is our residents themselves. Our residents are a fantastic group of people from unique and exciting backgrounds. And what's so wonderful is that every year we really learn from one another and we grow as a consequence. And then lastly, although it's so weird sometimes to say family when you're talking about kind of a workplace, I really think that we have a wonderful dermatology family. Everybody's really welcoming. Faculty and residents get along really well, and I think we have open dialogue with one another. And that's a really special environment to be in that really helps us all learn and grow. Next slide.
So Dr. Meyer and I want to take a little bit of time to discuss the different clinical sites and experiences here. At UW, we have 6 primary sites where you'll be doing the majority of your training. Next.
So starting off with one of the first locations is the University of Washington Medical Center. And that's where we have 2 clinical experiences. The first is our inpatient rotation, and that's where you're going to be taking care of some pretty medically complex patients who have skin disease. So there's a lot of learning there. The other opportunity there is our dermatopathology rotation, which you'll have a full month or more of, where you get to actually look at slides with the dermatopathologist and really get a good comprehensive understanding of dermatopathology. Our next site is not that far away from the medical center. It's like a little less than a mile. It's the Roosevelt Dermatology Clinic and Dermatology Surgery Center. And that's where we have a lot of our specialty clinics, like derm room, nail disorders, complex medical derm, pigmented lesions, hair disorders, patch testing, contact dermatitis, and phototherapy. It's also the place that you're going to get your Mohs surgery experience. So there's a lot of different things happening at that location, and it's all a great learning opportunity. Our third site is our VA, so our Veterans Affairs Puget Sound healthcare system, and that's south of the downtown of Seattle. And there you see everything. It's comprehensive. You've got inpatient, you've got outpatient, you've got surgery, you've even got telemedicine there that'll be part of your experience. And it's really a great population because a lot of those folks who are in the VA system are underserved. So it's an opportunity to help a broad group of patients.
Our next site is Harborview Medical Center. This is owned by King County, where our hospital system in Seattle is located, but staffed by University of Washington faculty. It's a medical center that gives residents and practicing physicians an opportunity to interact with and help a broad variety of folks who come from culturally and socioeconomically diverse backgrounds, and sometimes have various levels of insurance and access to care. It's also the only level 1 trauma and burn center in Washington State and is a referral center for the entire WWAMI. So that's Washington, Wyoming, Alaska, Montana, and Idaho region for derm emergencies such as Stevens-Johnson syndrome and toxic epidermal necrolysis. There's some other unique opportunities at the clinic as well, including Hansen's disease clinic, hidradenitis clinic, and opportunities in HIV-related dermatology as well. Our next site is Seattle Children's Hospital, which is near and dear to me as a pediatric dermatologist. This is a standalone children's hospital that similarly serves the entire WWAMI region. So the sort of breadth and diversity of patients that you see is quite broad. I think we're the best, but I'm biased. And one reason I think that is that the 4, soon to be 5 attendings that we have at Children's have a broad diversity of interests that also allow you the opportunity to get to spend some time in subspecialty clinics, including a pediatric dermatology rheumatology clinic, tuberous sclerosis clinic, alopecia clinic. We have expertise in clinical trials. There's lots of laser, both pulse dye laser, which is common in pediatric patients, but also CO2 laser and hair removal lasers, and both a extensive outpatient experience, but also inpatient pediatric dermatology as well. And then finally, we have the Fred Hutchinson Cancer Center. This is an amazing place to learn a lot of oncodermatology. We have one of the world's foremost experts in Merkel cell carcinoma with our chair, Dr. Paul Neum, but also a very robust cutaneous T-cell lymphoma service, as well as supportive dermato-oncology, melanoma, and clinical trials. And it should be noted too that the Fred Hutch is the birthplace of the stem cell transplant. So we're at ground level for innovations and exciting changes in oncology broadly, but also specifically cutaneous oncology. Next slide, please, Steph. So this is just an overview of what a typical first-year rotation might look like. You'll spend a few months at Harborview, the UW outpatient clinic at Roosevelt, and the VA is where you're going to be doing primarily most of your training during the first year. You'll have a month or 2 at Seattle Children's, as well as a month of DermPath and time on the UW inpatient consult service. One thing I want to point out is that during that first year, you're going to be getting lots of procedural and surgical experiences at all of these different locations, primarily at the VA, but also at Harborview, Roosevelt, and Children's as well. So your surgical and procedural training will begin early during your first year, and then there are more formal surgery rotations that are enriched during the second and third year of your dermatology training here. Next slide, please, Steph. There are additional clinical experiences that many people wonder about. So Continuity Clinic is present at all of our locations: VA, Harborview, Roosevelt, Seattle Children's, and the Fred Hutch Cancer Center, where you get to have a longitudinal relationship with patients over your 3 years here at UW. This also serves as a sort of surrogate family for you within the broader dermatology group, where you get to spend a lot of time with attendings and your co-residents in these continuity clinic settings, where you sort of learn what your style of treating patients is going to be and really blossom into your own unique self as a dermatologist. There's after hours call that begins about third to halfway through your first year and then into your second year. So that's 12 weeks that's taken in summary over your entire time, but primarily concentrated into the latter part of your first year and the beginning part of your second. We have opportunities, sort of historically, but also adapting to the times in light of COVID, to do telehealth and telemedicine, and gain experience and expertise, managing patients from that perspective. We have a medical genetics clinic with Dr. Jenna Seibert at the University of Washington. She literally wrote the book on dysmorphology and dermatology and genetics, so she is a wonderful person to learn from. And then we have various partnerships with other community clinics, including a hair clinic at Kaiser Permanente, other opportunities for procedural dermatology and Mohs surgery with community partners, as well as cosmetics. And then at the end of your training, before taking boards, there is a combined ear, nose, and throat and facial plastics head and neck course to get you ready to crush the cores and the boards.
In addition to all of these robust clinical experiences that Marcus just mentioned, we also have a lot of time to learn outside of clinic. We've protected learning time 2 half days per week, always on Thursday, and then often one other protected afternoon on depending on your rotation schedule. And in this time, and then outside of this time too, we have some really cool diverse non-clinical learning opportunities. We have patient care conference where we discuss interesting and difficult cases with all of the residents and faculty. The Seattle Derm Society is a meeting that happens every couple of months with the broader Seattle dermatology community. In addition, we have grand rounds, journal club. We do some cool experiences like seen in this photo where we go to the Seattle Art Museum and think about how we can learn from art and visual observation and how that applies to dermatology as well. And there are a lot of other more tailored research and career development opportunities that we can have as well. Next slide, please. In terms of the nitty-gritty of our didactics, these usually occur on Wednesday and Thursday mornings. On Wednesday, we have either grand rounds or the patient care conference. This is followed by a faculty-led didactic session, all of which are amazing and really tailored to our learning. And then after that, we have a more informal session with just residents where we go over upcoming events and things that we need to be thinking about, but also do resident-led quizzes and Codochromes. On Thursday mornings, we bond over virtual slides with one of our community dermatopathologists, Dr. Dan Lance, and he spends a lot of time going in detail over various dermatologic diagnoses on the slides. And then the rest of the morning is academic time, and this varies week to week. Sometimes we'll have journal clubs, sometimes we have time to just work on our own projects or meet with people. We sometimes will have more kind of fun bonding activities like a resident admin work party where we catch up on all our evaluations and other things we need to complete, or a book club where we all read the same book over, the course of the year and then get to sit around and talk over bagels and coffee. We will get a little bit more into this in a minute, but we also have cosmetic sessions, and those tend to be after hours, but are another good learning opportunity for us. Next slide, please. So as a second and third year, you will attend the AED and will be encouraged to submit an abstract for presentation at the gross and micro session. This is a really fun event where, we all go together and learn and to get to explore the whole conference. Other conferences that derm residents attend include the Resident National Psoriasis meeting, the American Society of Dermatopathology annual meeting, and the American Society of Dermatologic Surgery meetings. And we've had residents present at those every year. First and third year residents also attend a local meeting called the Pacific Northwest Derm Conference, which is typically paid for us and is a really fun opportunity to connect with local dermatologists. There are professional funds available to attend all these conferences, and especially if you are presenting. Next slide, please. We also have a lot of opportunity to interact with and teach medical students. This can be, anything from helping out with a suture session, teaching the medical students how to do basic derm procedures, to teaching residents more formally in the medical student med-sci course, which involves musculoskeletal disease, rheumatology, and dermatology kind of all grouped together. We do chief rounds or resident rounds when we're on the inpatient service doing kind of dedicated didactics to the med students who are rotating on dermatology. And then in all of the different rotations, we really interact with med students on a daily basis in clinic, teaching about the patients that we see and kind of helping them to navigate the dermatology world. a lot of us serve as mentors for med students who are interested in dermatology, and that's another really fulfilling experience that we have at UW. Next slide, please. In terms of cosmetics, we have sessions every couple of months where we spend about 3 hours with community dermatologists who teach us about Botox, fillers, lasers, chemical peels, and we get to kind of practice and experiment on each other as we learn. We have a really great group of community dermatologists who help us with that. We also get a lot of laser experience at Seattle Children's with Dr. Deepti Gupta in particular. And that is a growing area for us at UW. Next slide, please.
So twice a year, we hold 2 residency program retreats. So, and this is where residents get together with program leadership. So with the program director, associate program director, program administrator, and sometimes core faculty. When we have the fall retreat, it's focused primarily on team building, and you can see that awesome picture on the lower right. That's where we all got into a rowboat, which is kind of crazy because most of us don't row, and this is kind of a big Seattle experience. But we all got on a rowboat, we learned how to row, we didn't fall in, which is fantastic, but we got to reflect on how we work together as a team. So that was always fun, and we've actually been doing this now the last few years, and I think it's become a pretty nice tradition that we look forward to. In the spring, though, we all get together and we talk about the year and how it went, what went well, what didn't go well, and how we can be better. So we use that as an opportunity to make some program improvements, and resident feedback is really taken into account when we do that session. Next slide.
So many trainees who are exploring programs often have questions about, what is a department or training program's commitment to justice, equity, diversity, and inclusivity. This is something that's very near and dear to my heart. I think that all of us at UW understand that we all have various aspects of our identities, and some of those aspects give us privilege, while others may give others opportunity to marginalize us or, in other ways make us feel less than. And our goal, as we mentioned earlier on in this slideshow, is that everyone gets to be seen as their whole selves. And Jedi work is an important part of that. As a gay man, I feel very fortunate that I can be out and secure my identity here. And the environment that I want to create for all the residents is that no matter how you identify, that you feel that support as well. In order to achieve that, we do have a diversity, equity, justice, and inclusion committee who has really been actively shaping the curriculum and the direction of our department since 2019. Ways that Jedi work is communicated through the residency training. We have scheduled speakers who come in. Past subjects have included dismantling power hierarchies in medicine, cultivating diversity within the dermatologic workforce, having discussions and lectures around healthcare disparities based on race, intersections between climate change and environmental racism. So there's lots of ways where we want to make sure that all of our residents are trained as culturally competent and culturally humble practitioners that can provide the best care to any patient that walks in the door. At our annual division retreat, there's always an element of Jedi work that occurs then, and we have a formal culture of inclusion agreement that all faculty, staff, and residents sign and recommit to each year. We have done implicit bias and microaggression training workshops in the past, have done a number of books that we have read, as a entire department, as a residency program, more specifically also in the Jedi committee. That includes books such as Just Work, and Thick by Tracy McMillan Cottom, Black Man in a White Coat by Damon Tweedy. So a number of ways that we try to engage in this work outside of just the clinical realm as well. Historically, and I think now for the foreseeable future, we will be conducting remote interviews. We feel that's essential both in light of the pandemic and just being, good stewards of public health and not putting people at risk. This pandemic is unfortunately not behind us. And also, thinking about the environmental impact and the cost on trainees for, flying out. So that's another way that we see our, commitment to justice being played out in the way that we work and live and interview. Trainees in our program who do identify as underrepresented medicine also have access to other mentorship, networking opportunities here at UW. There's the University of Washington Center for Health Equity, Diversity, and Inclusion, and a network for underrepresented residents and fellows that give folks the opportunity to meet other trainees in different programs as well and build a broader community. Next slide.
And residents and faculty wellness is also a priority and value in our program. We really, really care about your health as a person and as a physician. And so as such, we actually have a wellness committee, and this is a group of dedicated individuals who come up with wellness activities that we all can participate. And they're just great. They're wonderful ways to build community with faculty, with staff, with other residents. So we have that as a center point of our program. Also, GME has broad wellness resources available as well as counseling services if needed. And you can look up more information about some of the wellness opportunities and resources that we have on our website. Next slide, please. We also have abundant opportunities for leadership. In our department, we have a lot of different committees, and including our Justice, Equity, Diversity, Inclusion Committee, Wellness Committee, Volunteerism Committee, Medical Student Education Committee, Communications Committee, and also the House Staff Union. So as a resident, you can play a part in each of these committees, or one of those if you'd like, whichever one speaks to you. And you can also be a leader, which is great because you're able to be involved in decisions that the department is making around these areas of interest. And it really allows you to have a voice. It allows you to practice your leadership skills and to be on par with, or I should say on the same level, and a lot of times with fellow faculty. And so that creates a really nice collegial atmosphere. Next slide. And then volunteerism is another, I think, wonderful aspect of our program. Many of our faculty and residents are very interested in giving back to the community. And we do so in many different ways, but some of the ways that we've all come together are doing our Seattle King County Free Clinic. This is a great multi-day experience where we give free dermatologic care right to our community. And I think this past year, we served over 170 patients in that time with one room, which was incredible. And then we also we also have skin cancer screenings like Melanoma Monday or other free skin cancer screenings throughout the year. There's a program called Doctor for a Day, which I know has been very impactful for a lot of people, where residents and faculty can teach underserved communities, the high school students in underserved communities, about medicine and about what it's like to be a dermatologist. So I know that's been a really wonderful experience. And then we do other ad hoc types of experiences, like being a food bank volunteer for a day, which has been great. We all get together and help pack gourds and other squashes, for people. It's just been fun. And then there's different types of opportunities that happen throughout the year. So it's a great way to build community and give back to the Seattle community. Next slide.
And as Marcus and Lisa have already mentioned, the residents are the best part about this program. We have a relatively small group, and so we all get to know each other really well. And I can't speak highly enough about my co-residents. We do a ton of fun stuff together. You can see in that one of those pictures is a group of us with my daughter there, and we have a little mom parent group of residents. We get lunch together and talk about kind of the joys and challenges of having kids in medicine. We get together outside of work all the time. Some things that residents have done is clamming, hiking together. We go to pumpkin patch every fall, and this year we're planning on doing a little pumpkin carving and wine night again. We usually do things around the holidays like Friendsgivings and holiday parties. We are planning a garden party this year and high tea. And then every year at the end of the year, we have this awesome summer party hosted by Dr. Lance, our favorite dermatopathologist, who teaches us on Thursday mornings, and he brings us over to his house and has nice catered dinner for us and shows us his like really impressive whiskey room. So a lot of fun stuff that we get to do together. Next slide, please. If you haven't been to Seattle, let me tell you, the food here is just delicious. We all enjoy going out to eat together, whether that is just grabbing sandwiches in the middle of a clinic day and sitting out on the patio during work, or going out to dinner after cosmetic sessions, which we usually do every couple of months. The food here is awesome. There's both delicious Pacific Northwest seafood fare and then more culturally diverse foods as well. And so if you come here, you will not run out of things to eat. Next slide, please. You have probably heard that in Seattle, people love the outdoors. And even if you are not a hiker or a skier by nature, you probably will be converted to one when you get here. There is just a ton of stuff to do. The mountains are here, the lakes. Even just within the city, there are beautiful parks to enjoy. One of these pictures you can see we're out at the Pumpkin Patch, which is just like 45 minutes away. If you are into skiing and hiking, you can get to the mountains within an hour. And so there's a lot of fun stuff to do outside here. Next slide, please. Our current residents have a strong affection for Seattle, as I mentioned, but we come from all over. We have hometowns in Alaska, Connecticut, Idaho, Michigan, North Carolina, Pennsylvania, Texas, Virginia, and Wisconsin. Some were researchers, pediatricians, internists, teachers, and musicians before starting at UW Derm, and I think that the diversity of our backgrounds is a real asset to the program. We collectively have kids, dogs, cats, and chickens, and a lot of impressive curators of houseplants, French cheeses, poetry. So people have a ton of different interests. We value diversity and believe it's key to optimal patient care and optimal learning. In a small program like ours, intimate program like ours, you get to do and see enormous amounts while getting to know your fellow residents and faculty really well. Supporting one another is an essential ingredient, and we make it a habit to help each other out, from sharing study tips and resources to after hours calls for consult advice. We have a group thread that is super active, both from just sharing about our lives and then, asking each other about various diagnoses or how to navigate things in clinic or in the hospital. Next slide. These are our current residents, all of whom are wonderful people, and you'll probably hear this from many programs, but I think that the best thing about our program is the people. Everyone is supportive, kind, interesting, and I think both faculty and residents treat each other as people first and, colleagues second. Next slide. This is just an example of where residents live. We kind of live all over the city and some people outside of the city. You can see in that like central cluster of stars, the just various neighborhoods in Seattle, University District, Capitol Hill, South Lake Union, Ravenna, Wallingford. In all of these neighborhoods, it's relatively easy to commute to our various clinical sites with public transportation or biking. Many residents do have a car and use that to drive to clinical sites, but I would say most of us do a mix of car and then either public transit or walking or biking to some of the other sites. Residents also do live outside of the city, so on the east side or Bellevue area, further down south in Federal Way, we have a current resident who's living on Mercer Island. And that can give you, a little bit of a more suburban or even slightly rural living setting, more affordable housing as well, that would require a car to get to some of our clinical sites. There, is a public transit system in Seattle as well. So there's the light rail, which is growing, and by the time you get here would probably be a even stronger commuting system than it is now. And then biking, walking is super accessible in Seattle. Many of us bike to our clinical sites.
Okay, I wanted to finish up by discussing applications for our program this year. First thing I just want to say is I think it's really important in this process where you're applying for dermatology. I know that it is fraught and anxiety provoking, and it's also helpful to sit back and look at how far you've come over the past 4 years and feel really good and proud about that before you submit your application. We understand it's a stressful time, and also it is a time to celebrate yourself and all the things that you've done. So we look very much forward to reviewing your applications, and here's the general timeline. So on September 6th, that's when ERAS opens up, and your application can start to be uploaded, as well as the MSPE from your medical school. And we need your application to be completed with all of the letters of recommendation, the MSPE, and the basic application by September 29th. That is our program deadline where we will be downloading all of your applications for review. On November 20th, we will participate in a coordinated release of interviews with a number of other dermatology programs across the country. And on December 4th, additional interview invitations may be released if available following this first wave on November 20th. Our interview dates for this recruitment season are Friday, January 12th, Wednesday, January 17th, and Friday, January 19th of 2024. As I mentioned earlier in the session, we think that conducting interviews virtually is the most equitable and just way of conducting them. So that is how they will be for this season as well, and probably for the foreseeable future. Steph, could we go to the next slide? So here are the application components. We will be looking at your ERAS common application form, your personal statement and CV, your med school transcripts and dean's letters, and then 3 letters of recommendation. Sometimes folks ask, like, what is the best way to make my application pop? I do think that, 2 places where you can really help us get to know you better are in your personal statement, where, whatever you feel comfortable sharing about yourselves that really identifies you as a unique person, certainly is a helpful way to differentiate from a number of other, accomplished applicants. And then your letters of reference, ideally, one will be from someone who can see you, who's a dermatologist who has seen you perform in a clinical dermatology setting. But beyond that, it can be from whomever you want. In general, what I recommend is finding a letter writer who really knows you well. So this may be, maybe you worked for 8 weeks with someone on your OB-GYN rotation and you really connected well, and you feel like that person has a good sense of how you function as a physician and what your career goals are. It's okay if it's outside dermatology. What we're really more interested in finding people who share our values, who are committed to patient care and will go the extra mile for, their colleagues and their patients. And want to have a good work-life balance. And so, if you can find someone who can speak to who you are as a physician, that's more important than getting a chair letter from someone that you only work with for like half a day who doesn't really know who you are. So that's another opportunity for us to really get to know you as an individual. USMLE, that is not part of our review of application. We do need to know that you have passed your USMLE by the time that you have started dermatology residency with us. But we do conduct a holistic review that's really looking at the entire application, and we don't have any arbitrary cutoffs based on USMLE scores or the number of honors that you've gotten on your 3rd-year clerkship. So don't keep that from let that be play any role in whether you apply or not. Other questions that come up, we do accept applicants who have already completed another residency. We do accept applications from international medical graduates, so we welcome anyone who is interested in our program. This year, the ERAS system has changed a bit to include program signaling. So each applicant receives 3 gold and 25 silver tokens. We don't know how this is going to play out. This is all programs' first time doing this, but we expect that given the number of applications that we historically receive, that it is unlikely that you will get an invitation from us if you don't signal us. So, I think what this entire system is encouraging is for people to be really thoughtful about where can I really see myself thriving and doing well, and then, administering those tokens accordingly. I don't think that gold versus silver is going to play a huge role. And the advice that I give to my mentees is to just be honest. The entire ERS system always favors medical students and their preferences. And so I think, instead of trying to game the system, just be honest. Look at the places that you're interested in being, where it'd be a good fit for you, either academically or, just like the community that would be there. Maybe you have, other family reasons that you might want to be in a certain area, and just trust your heart and your gut and give those three goals to the three programs that you think like, yeah, I think I could really thrive here. I'd love to be there. I don't think that anyone is going to be like, oh my gosh, like it's a silver, not a gold. We are excited that you're interested in our program, and certainly want to get to know all of you. So I think my best advice is just not overthink it too much, and really just, lead with your heart and your gut and where they're telling you that you might end up being a good fit. And, we hope it's UW. I will tell you this is always, one of my favorite times of year, just getting to know future colleagues in dermatology. The number of people that we interview and read their applications each year, just every year I'm blown away more and more. And I wish that we could train every single one of you. Unfortunately, we can't, but I look forward to having you as a colleague in dermatology, whether you train at UW or not. And hope that you keep us in mind for the future as well. We are a growing department officially as of October 1st of this year, and expect to be clinically expanding for a number of foreseeable years as we meet the growing demand for our services, both in Seattle and the greater WAMI area. So we really appreciate you taking the time to be with us today. We look forward to reviewing your applications and wish you all the best of luck. And yeah, just remember, you have come a long way. You should be proud of all the work that you have done, all of your incredible accomplishments. And so, that anxiety, it will be there, but trust in all the work that you've already done. And as I mentioned, we all look forward to reviewing your applications and meeting you. So thanks again for being with us.